Believe it or not, both springtime and much warmer weather are right around the corner. That leads to a lot of spring and summer sports. That also in turn leads to a lot of injuries, everything from sprains, strains, all the way up to concussion. There is some non-surgical orthopedic care that is available if you find yourself in that situation. And joining us now from the Erlanger Sports and Health Institute is Dr. Derek Worley. Dr. Worley, welcome to the show.
Thanks for having me.
Getting into spring obviously leads to a lot of strenuous outdoor activities. All of us at one point or another kind of take a little lull for the winter before we get outside. What are some of the things we can do to help us stay away from your office, regardless of whether your sport is something as relatively easy as golf or something as full-fledged as basketball? Any advice?
Well, I think the age-old thing that everybody kind of knows about is stretching, and doing stretching properly is very important. And doing it properly means that what we recommend is you get your heart rate up and get the blood flowing to your muscles before stretching. Kind of maybe some of the old school way of doing things where before you went out to run or bike, etc., you would stretch. But actually that might do more harm than good. We've kind of learned over the years that it's better off to get the blood flowing, whether that's just, doing a quick jog, just getting on the bike, getting the heart rate going before you do the stretching. And then once you start doing the stretching, you want to go kind of easy in the beginning and stretch till you feel tension, but you don't want to stretch till you feel pain.
I've heard a lot of folks say that not only is the warm-up and the stretching very important, you have the actual workout itself, whether you're hitting the gym or going out and doing your sport outside. But the cool down afterwards, the winding down period, is almost as important as those other two.
It is, and that's actually probably where stretching is the most important, is once you kind of finish your activity for the day, is stretching out those muscles, because it helps with the soreness that you may have afterwards.
All right. Now, what about, let's take, for example, golf, and you brought along a golf club here. If you're going to hit the golf course for the first time in a while, how can you use a club to help stretch, to help warm up?
So you can use that club to put around your arms to rotate the trunk of your body and
Like
move
that?
your arms. Yes, exactly.
And you want to do this in the front and in the back, if at all possible?
Correct, yes. You can put that behind your back and really stretch out those muscles. It's just something easy for golfers to have with them on the course to use.
What's another good tip that we can use in getting warmed up?
Just anything, whether that's going for a brisk walk, and just use your environment that you may have, and just anything to get the heart rate up is always good.
You specialize in non-surgical orthopedic care. Give me an example of that.
So anybody who has kind of a nagging pain, whether that's a strain, a sprain, somebody who has a fracture, what that is coming in, being evaluated, and what we specialize in is non-operative care. That doesn't mean that everything's not going to be an operative case, but 80 to 90% of injuries don't require surgery, and so we're specializing in providing care, whether that's anti-inflammatories, injections, therapy, etc., really trying to avoid the extreme measures.
One thing we're hearing a lot over the past year or two, regardless of the sport, the risk of concussion is seemingly much, much higher. Obviously, you want to avoid any possible reasons for a concussion, but those are certainly some alarming statistics when you look at the number of kids playing football and baseball that have a serious concussion. In the interest of team spirit, they're trying to get out and do all they can, regardless of the impact it has on their bodies. That's the wrong thing to do.
Yeah. I think really it's about being aware of it. I think we're recognizing it more than what we used to, so it's definitely out there about the concussions. And really, it's about teaching proper technique and doing things properly. Football, teaching kids to tackle with their heads up, block with their heads up. Soccer, proper ways to head the ball, etc. So I think sports are safe. It's just a matter of learning how to do it properly.
Can you give us a few examples of concussion symptoms?
So concussion symptoms, headache, feeling like you're in a daze, maybe having some problems with your memory, problems sleeping, you may feel nauseous, things like that are kind of early symptoms that you might experience.
And if those aren't treated properly, they can obviously lead to other more severe injuries a little bit further down the road.
Right, yeah, because what we worry about in sports is having a concussion that's undiagnosed and continuing to play.
Right.
And that's where we know people get themselves into trouble, is playing with a concussion.
Dr. Derek Worley, thank you so much. We'll have you back over the coming weeks, but this is nothing to fool around with, folks. If you think you have any sort of sport-related injury, you need to make sure and check out Dr. Derek Worley. And again, he is at the Erlanger Sports and Health Institute. You can find out more through their website. And Dr. Worley, the phone number is
423-778-3380.
All right, again, 778-3380. Stick around. We have more of Let's Chat right after this.